Hi everybody, I'm Dr. Carrie Reller, your Family and Obesity Medicine Board Certified Physician in Clearwater, Florida. My last video, I talked to you about the top 5 reasons not to use compounded semaglutide. Today, I'm going to pretend that you're going to use it anyway, and I'm going to talk to you about the top 5 reasons of what you should do while you're on semaglutide. Number 1, first of all, you should get a baseline lab set. This is very important to determine what your metabolic baseline health is. What if you want to go on this medication with your insurance in the future? Most of those medications like Ozempic, Wegovy, Mounjaro, etc. require prior authorization. This means we need to know whether you had an hemoglobin A1C to test for diabetes or prediabetes, whether you had a fasting glucose, whether you had a glucose tolerance test, whether you had a fasting insulin level, etc. These things are very important and should not be overlooked. You need to get baseline lab work. And that being said, you should also get follow-up lab work to see how you're doing. Number 2, I highly recommend you get a body composition analysis. It could be with a fancy scanner like we have in our office, the InBody scanner, because this tells us the difference between muscle mass loss and fat mass loss. It also, if you have the better machines, they can tell the difference between visceral fat and subcutaneous fat. Visceral fat is that fat around your organs. It's the dangerous fat. It's the fat that causes metabolic problems. That's the one we want you to lose. The subcutaneous fat is not as important, but it definitely may be important to you, as sometimes it's something that people want to, have less of to look better. These medications make you lose weight quickly. It's important to make sure you're having fat mass loss and not lean muscle mass loss. The body composition analysis can help with that. Number 3, protein. You want to eat lots of protein. These medications also make you feel pretty full. That means it's hard to get all the protein that you need in one day. It's important to work with someone who can help you develop some sort of meal plan that can make sure you're getting enough protein, so you're not going to have that lean muscle mass loss. I usually recommend about at least 90 grams a day. That's hard to do when you're not that hungry. Please take a look at protein and make it a priority. Number 4, fiber. Fiber is super important. One of the complications or side effects of the medications is constipation. Fiber helps us keep our gut colon healthy. You want to have a lot of fiber so you can have normal stools. It's really important. Don't forget about fiber, fruits, veggies, beans, etc. And number 5, lift weights. Resistance training is super important to maintain that muscle mass. Keep it up, do the good work. See you next time.